a sore throat that becomes organ failure, a routine exposure that lands you on life support, and an infection that doesn't just make you sick, it goes straight for your brain. Today, we're counting down 5 more of the world's deadliest infectious diseases, and some of them, like Hantavirus, are making headlines again right now. All right, let's dive right in. Number 5, tetanus. Let's start with a disease that doesn't spread through coughs, sneezes, or crowded rooms. You don't catch this one from someone sitting next to you. You catch it from the unsuspecting environment around you. Tetanus is caused by a bacterium called Clostridium tetani, and this thing is built for survival. It lives in soil, dust, and animal waste, forming spores that can sit there for years just waiting for the right opportunity. And that opportunity is usually a deep wound, especially one with low oxygen. Now, a quick Mythbuster moment here, because you've probably heard this before. Don't step on a rusty nail or you'll get tetanus. Rust itself doesn't cause tetanus. Rust is just oxidized metal. The real issue is that nails sitting outside, especially old, dirty ones, are often covered in soil where this bacteria lives. And more importantly, if or when a nail punctures your foot, it creates a deep, narrow wound where oxygen is limited, which is exactly the environment Clostridium tetani loves. Once those spores get into that low oxygen environment, they activate and start producing a toxin called tetanospasmin. Tetanus doesn't spread through your body like a typical infection. It goes straight for your nervous system. The toxin travels along nerves and blocks the signals that normally tell your muscles to relax. In other words, your body loses its off switch. And then comes the most dangerous part, breathing, or lack thereof. You see, when the toxin affects the diaphragm and airway muscles, they can lock up just like everything else. So now you're fully conscious, body in spasm, but you can't breathe properly. That's how tetanus can easily become fatal. Before modern medicine, survival was rare. Without treatment, tetanus can rapidly progress into a life-threatening condition requiring intensive care. So if you show up to the emergency room and we suspect tetanus, we move fast. But here's the part people don't realize. Tetanus hasn't disappeared. Globally, it still kills tens of thousands of people every year, especially in areas without access to vaccines or critical care. The real takeaway isn't fear of rusty nails per se. It's respect for what a tiny contaminated wound can do when the conditions are right. Number 4, meningococcal disease. Let's talk about a disease that doesn't ease you in. It hits fast, and by the time you realize something is seriously wrong, you're not just behind, you're fighting for your life. Meningococcal disease is caused by a bacteria called Neisseria meningitidis, and what makes it so dangerous is how deceptively normal it can start. This bacteria can live quietly in the back of the nose and throat of a completely healthy person. No symptoms, no red flags. It spreads through close contact, coughing, kissing, sharing drinks, just everyday interactions, nothing dramatic. Picture this. You're in a dorm or traveling with friends or living in close quarters. Someone feels off, headache, fever, fatigue. It looks like the flu. They go to bed early, expecting to feel better in the morning. But inside the body, things can be escalating fast. If that bacteria crosses into the bloodstream, it can trigger a massive inflammatory response almost immediately. And this is where the real danger begins. In one pathway, it invades the lining around the brain, the meninges, causing meningitis, severe headache, neck stiffness, light sensitivity, confusion. There's also the more aggressive form, the one that keeps ER doctors on edge, meningococcemia. This is a bloodstream infection that can spiral into full-blown septic shock in a matter of hours. You see, the immune system launches a full-scale attack, releasing inflammatory signals that damage blood vessels throughout the body. And at the same time, the clotting system goes haywire and tiny clots form everywhere while bleeding happens simultaneously. You can develop what looks to be a dark purple rash, but it's blood leaking under the skin as vessels break down. Then blood pressure crashes, organs stop getting perfusion, kidneys, lungs, and brain all start to fail. And even when you catch it, even when we are fast with antibiotics, fluids, and ICU care, the outcomes can still be devastating. Survivors may face amputations from loss of blood flow to the extremities, hearing loss, or permanent neurologic damage. Globally, meningococcal disease still causes tens of thousands of deaths annually, despite modern medicine. This is still an unsuspecting killer. Number 3, Hantavirus. Recently, Hantavirus has been making international headlines again after multiple suspected cases linked to cruise ship exposures, triggered international concern. Passengers became critically ill, investigations escalated rapidly, reports of deaths began circulating. And suddenly, a rare disease most people have never even heard of was dominating headlines across the world. But here's the unsettling part. These poor, unsuspecting people were simply boarding a cruise ship and going on vacation. And that raises the obvious questions for people. What exactly is hantavirus? Why can it become so deadly so fast? And should the average person actually be concerned? To answer that, we need to go back in time a bit. The year is 1993. A young, otherwise healthy man arrives at the hospital with what looks like a routine illness: fever, muscle aches, fatigue. Nothing dramatic, but over the next few days, everything changes. His breathing becomes labored, his chest tightens, oxygen levels begin to fall, his lungs begin to fail, but not from pneumonia and not from a typical bacterial infection. It was from fluid. This was one of the first recognized cases of hantavirus pulmonary syndrome. Hantavirus is carried by rodents, most commonly deer mice in North America. And what makes it particularly unsettling is how easily exposure can happen. You don't need to be bitten. All it takes is the environment. The virus targets the cells lining blood vessels, particularly in the lungs. But instead of destroying them outright, it causes them to be abnormally permeable or simply very leaky. As this fluid accumulates, oxygen can no longer effectively pass into the bloodstream. Patients can go from walking and talking to struggling for air and progressing into full respiratory failure in a matter of hours or days. Even with modern treatment, outcomes can be severe. Hantavirus pulmonary syndrome carries a mortality rate of roughly 30 to 40%, meaning about 1 in 3 patients may not survive. And that's not just a statistic from the past, that's the current stat. In fact, cases still appear every year, and in 2025, hantavirus made headlines again after it was confirmed as the cause of death of famed actor Gene Hackman's wife, an example of how a rare exposure can still have devastating consequences. Number 2, leptospirosis. Imagine a hurricane just tore through a coastal town. Streets are flooded, homes are waterlogged, but cue the horror music. In that water, the real risk might just be beginning, because mixed in with that floodwater, along with dirt, sewage, and debris, can be something microscopic and dangerous. A bacteria called Leptospira that's spread primarily through animal urine, most commonly rodents, and when heavy rains or flooding hit, that contamination spreads everywhere. You don't need a bite or a major injury. All it takes is a small cut in the skin or even exposure through the eyes, nose, or mouth. From there, the bacteria can slip into the bloodstream without you ever realizing it. Early on, leptospirosis doesn't look particularly dangerous. Symptoms often start with fever, headache, chills, and body aches, classically in the calves, but in more severe cases, the infection takes a very different turn. The bacteria spread throughout the body and begin affecting multiple organ systems at once. For starters, the liver becomes inflamed, leading to jaundice, aka yellowing of your skin and eyes. At the same time, the kidneys begin to fail, impairing the body's ability to filter waste, all while blood vessels become damaged, leading to internal bleeding. This severe form is known as Weil's disease. When it progresses, things can escalate quickly. In some cases, the lungs become involved with bleeding into the air spaces that interferes with oxygen exchange and leads to respiratory distress. Globally, leptospirosis is more common than many people realize. The World Health Organization estimates over 1 million cases each year, with tens of thousands of deaths annually, particularly in tropical regions and areas affected by flooding, poor sanitation, or close contact with animals. Number 1, Naegleria fowleri. Imagine it's a hot summer day. You're at a lake, a river, maybe even a warm freshwater pool. You jump in, go underwater, and for a brief second, water rushes up your nose. It's uncomfortable for sure, but usually pretty harmless. But in extremely rare cases, that single moment is all it takes for devastation to creep in, because in certain warm freshwater environments, there's a microscopic organism called Naegleria fowleri. And unlike most pathogens we've talked about, it doesn't infect your lungs, your bloodstream, or your gut. It takes a direct route straight to the brain. When contaminated water is forced up the nose, the amoeba can attach to the olfactory nerve, the nerve responsible for your sense of smell. From there, it travels along that nerve through tiny openings in the skull and into the brain itself. And once it gets there, it begins destroying brain tissue. Within days, neurologic symptoms begin to take over. Confusion, hallucinations, loss of balance, and seizures can develop as inflammation spreads through the brain. And once that cascade begins, survival survival becomes extremely unlikely. From a medical standpoint, this is one of the most aggressive infections we know. Symptoms typically begin within 1 to 5 days after exposure, and once they start, the disease progresses so rapidly that death often occurs within 5 to 7 days. And the most sobering statistic, the fatality rate is over 97%. Because this isn't a disease that spreads from person to person, it doesn't make headlines often. It doesn't need to. It just waits in the right water under the right conditions, and when the opportunity presents itself, it takes a direct path to one organ you can't afford to lose. So that's 5 more of the deadliest diseases out there. If you enjoyed this and want a part 6, please do me a favor and hit the like button and let me know what to cover next. And if you want to binge watch videos like this one, definitely check out this playlist right here with plenty more deadly diseases. Please don't forget to subscribe, turn on your bell notifications on top of that. That way you stay in the loop when I post a new video. Thank you so much for watching, and stay healthy, my friends.